It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our next guest is Amy Thompson, a dentist at New Life Dental Arts, talking about sleep apnea treatment and alternatives to CPAP. And you think of a dentist, Shannon, and I don't think of CPAPs and sleep apnea, but I guess it's the two are tied together.
Yeah, sleep apnea is a huge condition for a lot of people. A lot of people don't even realize they have sleep apnea, and it can be dangerous. Mm-hmm. When you stop breathing at night, your oxygen saturation rate goes down. But oral appliance or an appliance that you can wear at night sometimes can prevent sleep apnea. And it's a lot simpler for an oral appliance versus sometimes people just aren't uncomfortable with CPAP machines. You know what I mean? So an appliance might be a good option for you.
All right, Dr. Amy Thompson and Shannon O'Kelly.
Dr. Thompson, welcome to Health Talk. How are you?
I'm doing great, Shannon. Thank you.
Thank you for joining us. We're going to talk today about sleep apnea and alternatives to this CPAP. And I got to tell you, we've had a lot of sleep doctors on, but I've never, that I can remember, ever talked to a dentist about alternatives to the CPAP machine. So I'm excited to talk to you about that topic. But tell our listeners about your practice, your background, your training, your interest. I want to learn a little bit about Dr. Amy Thompson and what your practice looks like.
Absolutely. Well, I'm local. I grew up local, graduated from the University of Washington in 2004. And the reason I started getting into sleep apnea appliances and alternatives to CPAP was actually my father-in-law in 2010 had an appliance made. Back then, there was only one dentist in Seattle that was able to fabricate them. And in 2010, he needed a new one. And I was out of school and he wanted me to make it. So I made one. It was kind of my first guinea pig. And then after that, I just started having so many patients ask about it because CPAP can be really cumbersome for a lot of people, and especially for people who travel, or in the Northwest, we all love to go camping and there's not always electricity. So I've had a lot of patients over the years who have asked me about it, and I started getting really serious about it. In 2014, we started getting in network with medical companies because medical insurance covers it. And over the years since then, I've done extensive training, done a residency on it. And sleep medicine and dentistry is becoming more and more, there's more and more awareness about it because dentists now, we're actually required to screen all of our patients for sleep apnea, just like we do oral cancer. So a lot has changed in the last decade regarding that. So overall, even though I might be the first dentist on your show, there's so many dentists out there who are screening, and patients might not even know that their dentists are screening them for sleep apnea now. But I'm one of many in the region, I'm sure. And I've just been doing it for a long time and have a lot of connections in Puget Sound.
I would imagine that a lot of our listeners don't even realize that a dentist can actually provide intervention for sleep apnea. It's ironic, in the last 2 weeks, I've probably talked to 2 or 3 people that I've talked to them about sleep apnea, and they have a CPAP machine. So maybe you can talk about the screening, and let's talk about the anatomy. So how would a dentist affect the anatomy, and what's going on, and what are you intervening in from an anatomical standpoint, as we look at the epiglottis and everything going on in the mouth there?
Yeah. So what we're looking at, really the first signs of sleep apnea show up on your tongue. The size of your tongue can make a difference. And most of the time, it's not necessarily if your tongue is large. It can be just that your mouth is narrow. So if there's not a lot of space for your tongue in your mouth, what can happen is you get what we call a scalloped tongue, where your teeth start making indents on the sides of your tongue. And that's the first thing that dentists and hygienists are also screening when you're in the office as well. And the tissues can get really red and inflamed, and tonsils can be a problem as well. So there's a variety of things that we're looking for. The biggest key is the tongue, and that's kind of what we deal with oral appliances for sleep apnea. The difference between that and CPAP is we're trying to keep your tongue from falling back onto your throat at nighttime.
Interesting. We're going to take a real quick break here, Dr. Thompson, but that is interesting. Again, when we come back, let's talk about the intervention and the appliance and how you build it and make it and the results, okay? Good stuff.
Thank you.
Dr. Amy Thompson and Shannon O'Kelly continue to talk about sleep apnea and CPAPs and alternatives coming up next on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
We continue our conversation with Dr. Amy Thompson and Shannon O'Kelly.
Dr. Thompson, again, thank you for joining us here on Health Talk, and thank you for shedding light on how a dentist like yourself can intervene with sleep apnea. You talked about the tongue, you talked about some of the anatomy, but as you screen this, what is your intervention and what are the results? Let's talk about the actual treatment, I guess.
So the oral appliance, the goal of it is and there's a misconception out there. A lot of people think we're actually bringing your jaw forward, but for half of patients, it's just preventing it from falling back. So we don't necessarily even need to bring your jaw forward to solve the problem. And the appliance basically is two night guards that hook together somehow. There's hundreds of them out there. There's lots of different brands out there. It's not so much the brand, it's just what's going to work for you and what patients will wear. And the appliance works about 85% of the time. CPAP, it works 100% of the time, but patients can only wear it about 50% of the time. So the appliances are there's a lot more compliance with the oral appliance because it's easier to use. You can travel with it. You can pack it up and put it in your pocket if you're going overnight somewhere. So the convenience factor is a lot better. And for people who have TMJ pain, the appliance actually can help resolve those issues. And that's another misconception out there, is that oral appliances can cause TMJ issues. But it's usually the cart before the horse. The TMJ issues are being caused by a greater problem, and the appliance is there to help kill two birds with one stone with TMJ issues and sleep apnea.
So essentially, the appliance that you fabricate and build custom for this patient's need really kind of eliminates any soft tissue getting in that airway that would cause a blockage, then causing sleep apnea. I mean, I'm just trying to kind of connect the dots here. Yeah, is that essentially what it is?
Yep, that's exactly what it is.
I mean, I'm curious. I'm sure some of our listeners are going to ask, why does this happen only at night, and why don't I have these symptoms, or why does not my tongue get in the way during the day when I'm just doing my daily activities?
Right. So when we get into REM sleep, especially, our body goes paralyzed. And during the day, you've got a lot of protective mechanism. Your brain knows where your teeth fit together, and that's where your teeth fit all day long. And at night, that's all forgotten because we're paralyzed in our sleep. So what happens, especially if you like to lie on your back, the soft tissues and everything falls and collapses because your lower jaw falls backwards. So the appliance is just going to keep it in position and prevent it from falling back.
This sounds like everybody needs to have this looked at, because I think the world and the public
absolutely
would probably be shocked how many people probably experience sleep apnea and we really don't know. Maybe we snore, but these sleep studies are becoming more popular. The statistics on the amount of Americans and the number of Americans that do not get sleep. You're talking about something that seems very simple that can get 85% results. So, this, and how long does it take to get the appliance fabricated and get it in use? I mean, is this like a visit, a second visit for fitting, and you're off and running, so to speak?
Yeah, it's about 3 weeks.
Wow. Dr. Amy Thompson there in Snohomish, Washington, an alternative to sleep for sleep apnea for the CPAP machine with an oral appliance. Man, thank you for your time and thank you for your information. That was great.
Thank you, Shannon.
You've been listening to Dr. Amy Thompson, a dentist at New Life Dental Arts, talking about sleep apnea treatment alternatives to CPAP. And I am a CPAP user myself, Shannon, and I'm always on the lookout for alternatives.
Yeah, it was only a couple of years ago that I realized dental applications or appliances can maybe prevent sleep apnea by just controlling that opening, that airway opening. Interesting stuff.
Absolutely. Thanks to Amy once again for her expertise. NewLifeDentalArts.com for more info. Final segment next on Como.